I wanted to start, we're going to talk a little bit about the forum in a moment in terms of what we're trying to achieve through this forum, but I wanted to start by talking about this document, which I hope some of you will have seen, and I should have checked whether copies are available. I'm hoping they'll be available for you to see today. So it's an important document, and it's called Call for Action London. And what it does is set out the case for transforming London's health services, and in a way that I think is stark and unprecedented. And I just wanted to say a little bit about what it says. And its key message is that if we do nothing, if we just carry on as we are now, then we will fail the people of London in quite a profound way, and therefore we need to rethink how we take forward healthcare in London. And it triggers a debate. So if you look on the Healthcare for London website, you will see that we've started the debate today with London's population, with its communities, its staff, carers, representatives. We want everybody to come together to talk about both the challenges that we face in this city and also what we need to do about them more importantly. Now, we all know here that we've got some of the very best healthcare in the United Kingdom and indeed the world. People come all over the world to use our health services in London, legitimately I might say. And we've achieved a huge amount. So certainly for me, I get frustrated when people say it's impossible to drive change in the NHS. I think we have proved again and again, certainly over the last 7 years, that it's possible to deliver very significant change which impacts people's lives. So we've driven the changes in terms of stroke and trauma centres, in terms of heart attacks, and also through the clinical senate and our clinical networks, which we have over 1,000 clinicians across London engaged in designing and transforming care. We've developed clinical standards of emergency care, which, if implemented, will deliver 7-day working across the whole of the capital. So that would mean that wherever you fall ill and whenever you fall ill, you would get the highest possible care. And I know from just looking around this room that many of you have been part of that journey, and I think we need to build on that, and we should be rightly proud of what we've achieved in this city. But as the document says, the challenges that we face, certainly in my experience, and commentators that are far more experienced and well-read than me would say, are absolutely unprecedented. So our population in London is growing very significantly. In 7 years' time, it will have grown by another 1 million. We are growing faster than any other region in the country. Our birth rate is the fastest than anywhere else in the country. Newham, the London Borough of Newham, has the highest birth rate of anywhere in the United Kingdom. And another thing that is changing in London is previously we have had a population which has generally been younger than the rest of the country, and indeed that is still true. But we are increasingly seeing, and over the next 7 years, we'll see an increase in the numbers of over 65s, and that will increase by just under 20%. So that is very profound in terms of how we organise our health services. And many of those people, as you know, will develop one or more long-term conditions. And the numbers of people, for example, suffering from dementia in London will increase by 16% in the next 5 years. So the question for all of us is, are we ready for all of that? And my analysis would say we're not. And the other thing that's changing, and I'm sure other speakers will touch on this, is the reasons people are becoming unwell are changing quite profoundly. In particular, Londoners' lifestyles, their alcohol consumption, their smoking, their diet, they're all things that people talk about in the media, but it's becoming a very, very, very real issue for us in London. And we can start to see that increasingly numbers of younger people are acquiring diseases like diabetes at a much earlier age. And these are preventable illnesses, as we all know. If you look at children in London, 1 in 5 children are obese. As I stand here now, 1 in 5 children are obese. And London is the European capital of childhood obesity. And if you look at the projections and you look at what commentators would say about that, they would say that many of those children will not live as long as their parents if we do not tackle that as an issue. Very profound issue in London. And we also have huge variability in relation to primary and secondary care. We do have services like the London Chest Hospital, where it doesn't matter when you need their services. It doesn't matter whether it's a Wednesday afternoon, a Sunday evening, early hours of Saturday. You will get exactly the right care 24 hours a day, 7 days a week. But that is not the truth for a whole range of services in London. And we need to move forward to implement 7-day services and to save what we estimate to be 500 lives a year. And we've got to also move care upstream and start catching conditions earlier. 1 in 3 cancers in London is diagnosed in A&E. 23 of our boroughs are in the bottom breast screening rates nationally. If we in London were able to move our screening rates to equivalent of the best in Europe, we would save 1,000 lives, 1,000 people in London every year who we are not detecting cancer would be saved if we could deliver in that way. And finally, and certainly we've been doing a lot of media today, and this is the one that gets the headline, the financial context is more challenging. And you'll see we've set out in the document that if we continue with the burden of demand that we have and we don't address it, we'll have a £4 billion gap in the next 7 years. Now, the first review of London's health system happened in 1892. I had a look at it. It was a review of the Metropolitan Health Services, and it was done by the Lords Health Select Committee. And it said that care was not sustainable in the capital, that Londoners received too much care in hospitals, there were too many hospitals, that Londoners' health depended too much on where they lived, and there was significant variation in hospital and primary care, and there was a need for good primary care for the neediest populations. Does that sound familiar? And since then, there have been 11 further reviews of London's health services. And if you look at each of those, they've all said the same thing. So I think the diagnosis is clear. The latest of those was in 2007, Healthcare for London, by Lord Darcy. We have made progress, as I've said, but we have not made it quickly enough. And I'm sure we'll return today about all the barriers that we've faced as to why that is. But I think what the document says is that where we are now is absolutely game-changing, both the scale of the demand in terms of on our health services, but also the financial constraint. And I'm sure, like you, when it's party conference season, I listened carefully to all of the different parties talk on health. I didn't hear any of them talk about increasing expenditure on health. So all of that requires action, and making gradual improvements, albeit the improvements that we've made at the pace that we've made them, is not going to be enough. So what we're doing today is setting out the call for action, starting to debate with Londoners, to talk about what do we do about those challenges, and asking clinical commissioning groups and health and wellbeing boards to come together in their local health economies and start to think about what that means. And over the coming months, that will lead through to the development of plans where we will start to see how London will start to respond to those issues. And that feels to me at a personal level, you can't think of a more important mission that this group of people have the role in terms of talking about how we respond to those challenges and ensuring that we create a health service that's safe for the future generations of London.